Dear colleagues, I am happy to discuss with you our recent article that has been published in the Honorable Fertility Sterility Journal and is aimed at finding the predictive factors for positive sperm retrieval using the testicular sperm aspiration method in patients with non-obstructive azoospermia. As you all know, microsurgical testicular sperm extraction is the gold standard sperm retrieval method that is associated with the highest sperm retrieval rate and with a detailed magnified dissection of the testicular parenchyma where the dilated seminiferous tubules are sampled and are more likely to contain sperm. Having said that, micro-TC is certainly considered a costly procedure and requires the presence of a skilled microsurgeon who may not be available in certain parts of the world. Moreover, micro-TC is also an invasive procedure where the testicles are completely bivalved in order to conduct the dissection, and this could have a negative effect on testicular function as evidenced by the temporary state of hypogonadism that is often seen in these patients. On the other hand, testicular sperm aspiration is certainly a less invasive procedure and a less costly one. However, it is associated with a lower sperm retrieval rate as usually the testicles are blindly biopsied and the areas of spermatogenesis could be easily missed. As our center is a tertiary governmental hospital where all the sperm retrieval procedures are performed completely free of charge, we adopted a staged sperm retrieval method where we usually start with testicular sperm aspiration, taking 4 samples from each testicle and proceeding to microsurgical testicular sperm extraction if no sperm are identified with the testicular sperm aspiration. In order to achieve our aim, we conducted a retrospective chart review of patients with non-obstructive azoospermia who underwent their first staged sperm retrieval method at our center. A total of 297 patients were included in the analysis. The sperm retrieval rate with testicular sperm aspiration was 23%, while that with microsurgical testicular sperm extraction was 42%. The predictive model used was the lasso procedure coupled with a 10-fold cross-validation. The results revealed that serum FSH and average testicular size were the only positive predictors of sperm retrieval with testicular sperm aspiration. The obtained correlation coefficients were then used to construct an equation for predictive probability that showed an area under the curve of 0.742, indicating moderately good performance. An FSH cutoff of 8.5 international unit per liter and an average testicular size of 7.75 ml were found to have the highest sensitivity and specificity in predicting a positive outcome with TISA. The sperm retrieval rate in patients with an average testicular size of more than 7.75 ml was 34%, while that in patients with an FSH level of less than 8.5 international unit per liter was 36%. Patients having both an FSH of less than 8.5 and an average testicular size of more than 7.75 had a sperm retrieval rate that was equivalent to what is obtained with microsurgical testicular sperm extraction. This indicates that testicular sperm aspiration may be a suitable alternative for microsurgical testicular sperm extraction in some non-obstructive azoospermia patients, particularly those who have an FSH level of less than 8.5 and a testicular size of more than 7.75. This model could be a promising tool for counseling non-obstructive azoospermia patients who are undergoing sperm retrieval, particularly in communities where expenses and/or expertise are factors to be considered. We intend to generate an online calculator that would aid clinicians in assessing the predictive sperm retrieval rate for individual cases.